What's up, everybody? Welcome to another episode of Tech Backstage. My name is Eddie, and I am joined by our guest today, Nadia Adams, who is the founder of Blue Agilis. Nadia, how you doing today?
Doing well. How are you doing, Eddie? Thanks for having me
I'm
on the show.
Yeah, I'm doing great, and thank you for being here. I'm really excited to have you on the show. Current development customer, and really excited to be working with your company. Um, Before we dive into the topic today, I'd love to, hear a little bit about your background and how you came to found Blue Agilis, because I know that your origin story is, it's baked into the founding story of Blue Agilis. So I'd love to tell the viewers a little bit about, where you came from and how you ended up founding Blue Agilis.
Yeah. So I am very passionate about disrupting the healthcare industry, specifically improving health outcomes and the value that consumers get when they access our healthcare delivery system. The reason why I'm really passionate about this is because due to a series of preventable medical events, my younger brother has severe brain damage. And so my family and I have kind of lived and breathed what it's like to actually have a loved one that will need 24/7 care for the rest of his life. And these series of events, we really don't blame any individual. I believe that there's really bright, talented, some of the most highly educated individuals working in our healthcare industry. But the reason why we're seeing all of these preventable errors and deaths is not because of the people. We have great, passionate people, but it's really because of the broken system. And
Hmm.
so I've kind of really dedicated my whole career into helping to make sure that we eliminate preventable medical errors and deaths. Because the statistics are alarming. 1 in 4 patients that access our healthcare system today receive preventable medical harm, and that doesn't even include preventable medical death.
And that's a staggering statistic. And I think it's actually when I remember when I first talked to you, I was a little bit surprised, honestly, because I don't want to say it's the best in the world, but when you think about the U.S. healthcare system, you like to think that we have some of the most advanced medical facilities in the world, and you think we have some of the most qualified doctors and nurses in the world, and like you said, a lot of this it's not because of that. It's just because of preventable accidents and things like that happening. But like when you first told me that statistic, I was like shocked, honestly. And then, but what's funny about it, it's kind of like when you see you've never seen your car on the road until you buy it, and then all of a sudden you see it everywhere. So it's like right after I started talking to you, I started seeing all these stories about people. I saw a story on LinkedIn the other day about a guy who had gone in for kind of some routine medical stuff. I think it was around an infection, and ended up having a heart attack due to uh what due to the medical treatment that he received. And I mean, luckily he survived, but that's something that's 100% preventable. And so frankly, for me, it was a little bit shocking. Love to circle back before we dive into the topic, because um you said you dedicated your entire career to disrupting the healthcare industry. um that's a pretty bold statement. And I think it's very brave, to have that as your mission. And I love that you guys are so mission driven. But tell us a little bit about how you ended up coming to found Blue Agilis, and maybe a little bit about your journey to, understanding the backstory with your brother. But what was that thing that made you go, hey, I got to start this company, because everything else that I've done so far in my career has not given me the effect that I need it to have on the industry.
Yeah, that's a great question, Eddie. So the healthcare industry, I don't know if the viewers are aware of this, maybe some of you are, but we're really kind of a lagging industry when it comes to innovation, being nimble, um, And we've done great things. Like we have like really great specialists, like you said, and really great like diagnostic tools and tests and things like that that have really helped take healthcare discovery and really drug development and all those things like to the next level from kind of where we stand as a US healthcare system. But there are so many improvements that need to make within our system. That's just about making sure, like for example, making sure that we're giving the right patient the right surgery at the right time on the right leg, for example, right? And so we've done a lot of amazing things in terms of like innovation and discovery, but there's also a lot of just day things that we can do better. And that's kind of where I started my career. I started it in quality improvement because it was how do we actually improve the processes, the care processes of care delivery, so that using the example that I use is if a patient needs surgery, we're ensuring that the way that the patient gets their surgery is being done in a zero error, zero waste manner. So surgery done on the right body part at the right time, and then when the patient is done with surgery, having the right care plan so that they can recover and get back to the day-to-day activities that they want to do, like going out and seeing their grandchild's ball game, for example. And that's where really things sometimes don't always work the best way that they do. And like kind of what you said about like, you know, once you get a car, then you kind of see it more often on the road. That's what I see, right? So being in my field, I know what standards of care to expect. And what's really frustrating and why I continue to be motivated to make it my mission is every time myself or my loved one or a friend accesses the healthcare system and they tell me their story, it's not really the standard of care that they should be giving, right? Getting. And I'm not saying that, like, I don't want anybody that's tuning in right now to think that I'm like totally poo-pooing the healthcare system. Like I really do think that there are amazing things that have been done by really amazing people. But I'm saying there is another, like, there is another level of care that can be delivered, because if you think about the airline industry, they don't say, hey, we're going to fly the plane today and it's okay if 25% of the planes don't make it to their destination, right? And
Right.
that's all I'm trying to get to is with Blue Agilis is how do we actually improve things that can be improved so that when consumers access our healthcare system, they get the value that they deserve. And you'll hear me talk about value a lot. Value is really how I define it, the quality and health outcomes that one receives with the cost of care, because cost is also a major issue in our healthcare system that has led to a lot of health equities within the system itself. And so I started my journey in quality improvement, realize that the tools that we have access today, healthcare really adopts a lot of quality improvement tools from other industries. And so I remember, like, for example, lean in Six Sigma being like the flavor of the years, I will call it. And lean has a time and place for when it works. But what is different about healthcare is the complexity of healthcare. So we're not just saying, okay, how do we create an efficient process to make more tires or better widgets? We're saying that there's a group of people that are humans. They're not robots, right? They're physicians, they're nurses, they're medical assistants, they're social workers. There are a lot of individuals with different expertise and backgrounds that are all coming together to try to provide patient-centric care, whole person patient-centric care for the patient. And these individuals are semi-autonomous and semi-dependent. I like to use those two words because none of them can work fully on their own. They have to work together. But because healthcare is really complex, this working together to deliver the best value to patients is so broken because we have so many silos. And so I noticed like tools like lean and other quality improvement methodologies only worked for certain problems that I call more
Right.
complicated problems.
Right. So just really quick, I want to back up there because I think there's a lot to unpack there. But can Can you talk, like maybe walk us through what some of those different silos are? And, because it's like one of the things that I always see as well, not just in medical care, but like when things are siloed and there is an efficient communication between them, um, things can be happening in one silo that the other silo is not even aware of. And that I think leads to some of the outcomes that you're talking about right now. But what are some of those silos that you guys see in the medical industry? And what are some of the challenges that you see, with communication and actually, translating of information from one silo to another?
Yeah, Eddie, another great question. So one silo is even silos within specialties of care. So you have primary care physicians and you have a bunch of specialists, and they don't always communicate with each other, even if they're within the same health system, working on the same electronic health record. And so when I talk about the value and the cost of care, there's so many duplication of tests. So that's cost to the consumer, right?
Right.
So if you're getting tests ordered at your primary care and the same test ordered at your specialist and the same test ordered at another specialist, that doesn't need to occur to provide your care. So that's one of the silos. The other silos are also within teams of care. So if you think about how healthcare started back in the day, it was like home visits where you had the doctor with his medical bag going out to houses and treating patients. And so now we're in a place where we're moving to team-based models. And I think when you're moving to team-based models, not everybody knows how to do it well yet, because there is so many different types of individuals that may need to be involved. And as with anything, not just healthcare, communication. And
Right.
I don't think we can like stress communication, but those are kind of like the silos that I noticed. But the thing that really has driven Blue Agilis to when we launched the company January 2021 is we know that we can't fix. We're not a company and we're not a solution that fixes all these problems.
Hmm.
But we understand healthcare deeply enough to know where these silos exist and where the opportunities for improvement can be. And so I know that there's a lot of health tech companies that are being started out there. And I think the difference between where my co-founders and I are coming from is we're not tech people going into healthcare. We're healthcare people that have worked in healthcare. Like I have co-founders that are physicians, and we understand healthcare deeply, and we're going to tech to make our solution scalable. And
Yeah.
so where we've seen it not work is when there's too much standardization in how to intervene to produce a better health outcome without thinking and recognizing the uniqueness of different providers and their preference on how they treat their patients,
Yeah.
practice workflows, or even patient populations.
Yeah. No, I love that. And I think that's a great segue actually into really getting into the meat and potatoes of the topic, which is you guys disrupting, healthcare status quo. So talk to me a little bit about, let's dive into Blue Agilis and let's talk a little bit about how are you guys taking a look at this problem, and how are you guys helping to contribute to the solution? Maybe walk us through, because I was really fascinated when you first showed me the workflow and what your solution is. um it was easy for somebody like me to to be able to understand, because I'm not in the healthcare space. I'm, like, I've never even worked in healthcare. I don't even like going to the doctor. So I go because I have to. My wife makes me, but like if I had a choice, I'd never go. But it was easy for me to understand. But I'd love to talk just a little bit about how you guys are looking at the problem and how you're working to address it and come up with a solution.
Yeah. So kind of going back to my first statistic, and I'm going to throw out maybe one or two other. 1 in 4 patients that access our healthcare system today receive preventable medical harm. That does not include preventable medical deaths, as I mentioned. And this was a statistic pre the pandemic, pre COVID-19. And as we know, the pandemic has really created a lot of stress and burnout in our healthcare friends. And so the number could even be a little bit worse. And so if you think about this number, 1 in 4 patients that access our health system receive preventable medical harm. Why? So where Blue Agilus comes in is, every day we have people tackling issues about, how can we provide better care for diabetics? How can we provide better behavioral health? How can we look at, unnecessary ED utilization? Because there's a lot of patients that are going to the ED to get care, and they don't need to get care there, right? It's not of value to them personally for their health and definitely their pocket. And so when you think about the problems and why, there are proven evidence-based solutions out there that have been discovered by amazing individuals, amazing scientists, physician scientists, clinical scientists out there that are specific in healthcare. But I'm not sure if you're familiar with this statistic. On average, it takes 17 years for any new evidence-based discovery to be implemented into routine healthcare settings. And out of all of the evidence that's being discovered through NIH or whatever research or funding organization, only up to 1% of that evidence-based practice is ever even experienced by you or I.
That's
Okay.
incredible.
Yeah.
It's
And
mind
so,
blowing.
yeah. And so what we do is we say, okay, we know that there's problems and we know that there are solutions that are proven evidence-based solutions, right? That has worked. How do we take the problems and match your problem, whatever healthcare organization that we're working with, to solutions that are proven? And then we go a step further because, one of the things I mentioned is too much generalization and standardization doesn't work in healthcare because it doesn't take into account the local differences. And so if you read a JAMA article or a New England Journal of Medicine article and you look and say, oh my gosh, Cleveland Clinic or wherever, Johns Hopkins, they did this great intervention that improved health outcomes, patient experience, cost outcomes. I'm going to do the exact same thing and I should get the exact same results, right? Well, that's not the case. You can do the exact same thing, but you will not get the exact same results if you don't take into account those local differences. And that's what our technology does. We validate the problem that an organization has. We have a smart solution search that matches proven solutions to the problem that they have. And then we take it a step further and we understand their provider beliefs and attitudes, practice attributes. And we can say, based on this patient population, this is how this evidence should be localized so that you are actually successful at meeting your outcomes that you want to deliver and can rapidly implement the intervention that you want to implement. And so we run these rapid sprint cycles because it's all about understanding what localization needs to happen. And then once we get like a proven solution that works for that environment, our platform auto generates a minimum standard operating procedure. And so that's kind of what we
Incredible.
specifically tackle.
That's incredible. I love that. And I love this is something that I drive home all the time. A good buddy of mine, he's actually he's the CEO of a company called Money Geek, but he I don't want to say forced it on me, but heavily recommended numerous times that I read the book Working Backwards, which is about the AWS, or not just AWS, but about the Amazon process. And I love what you're talking about here, which is, you're looking, hey, what's the outcome that we're trying to drive here? Like, start with the end in mind. Like, what are we trying to get to? Are we trying to get to, less cost to the client or to the patient? Are we trying to, reduce, I think one of the ones that you brought up to me was, and I can't remember the exact statistic or what it's called, but when we talked previously, like return visits, like reducing return visits to the facility and
Readmission.
readmission. There we go. There it is. But like you're looking at things like that, like, hey, what are we trying to do? Well, we're trying to reduce readmissions. Like, okay, well, cool, great. We got a goal in mind. What does that actually look like in practice? And how do we get from where we're currently at right now to what that actually looks like in practice to actually get to that end result? And I love the approach that you guys take because something like a, like a guy like me who's just a software engineer can actually sit down and understand. Because to me, the health, probably just like a lot of people developing software is a mystery. Like to me, the healthcare industry is a mystery. But
And it is too
yeah,
many.
yeah, but
But we
you take
all
it.
have to like we all have to access it at some point,
Mhm.
right?
Yeah, yeah, and so, like, I think that's what's great about what you guys are trying to do right now is it's digestible for a lot of people, not even just the people that are in the healthcare industry. It's digestible to somebody like me, who's a complete outsider, because it's an elegant solution to, looking at outcome driven processes. And also, this is something that I deal with on a daily basis. But when I first started my company, we were like, oh, anti process, we're never going to be that company. But you realize that as you grow, the processes actually help you be more efficient, and they actually help you set standards, and they actually help you be able to be a data driven organization. And so I love the approach that you guys are taking, and how you're implementing that into the healthcare industry.
Yeah.
Um,
You've said a lot of things there, Eddie, that I have some like things that I want to piggyback on. The
yeah, I'd love
thing
to
that
hear
you
it. Yeah.
said about creating those processes for scaling, right? I totally agree. The only thing that we do different is we revisit the minimum standard operating procedure every 6 months because we know the real world is dynamic and ever
Right.
changing. And so where we've seen it fall is if you think about traditionally when you have a process and it works, you're just like, okay, just do that process all the time.
Right.
But if you don't revisit it, that process, some parts of it could be outdated. And
Hmm.
that's when things fail. And then you go and talk to people and you're like, well, why are you doing things that way? Because that's how we've always done it. Well, it doesn't give you the outcome that you need anymore, but that's how we always do it. And
Right.
so we really use what we call it's based on agile science. So there's 2 books that have been published by a couple of my co-founders, Agile Implementation, Agile Network. That covers the science behind our methods, but our tools we call agile transformation. And so it's really this rapid of, you know, having processes to scale, but being agile in the way that you think about those processes to account for this dynamic future. Because I always like to say the real world is a video. It's not one snapshot in time. It's not one picture.
Yeah, and I think that's important to understand too, because even if you have these operating procedures and they're documented, what ends up happening also is that you start to get deviations in those processes, because maybe you show me the operating procedure, maybe I memorize it and I never go back and look at it again, but then the next person who works underneath me, I teach it to them my way, but there might, that's where it's kind of like playing telephone, right? Like you give somebody one message, and by the time it gets to the end of the line, it's something completely different. So it's something that you have to continue to revisit. You have to do accountability checks. You have to make sure that, does this procedure need to be updated? If not, is everybody continuing to follow it the way that it's supposed to be implemented? Are we seeing the expected results? Again, I'm a data driven person. I like to look at the numbers every day and go, are we headed in the right direction, right? And then so, because that's the other thing, is like, what happens if you put an operating procedure in place and then you actually start to see deviations from the
Exactly.
expected outcome? What do you do at that point? You know what I
Yeah.
mean?
Yeah, and that's where our whole process of running agile sprints on the intervention, because and one thing that I want to add, because you were saying something earlier that made me think about this too, is I'm not a physician, I'm not a clinician at all, but I have worked very closely with physicians my entire career. And one of the things that in healthcare we got to remember is our physician colleagues drive how care is delivered. And unfortunately, in some cases, we've been in this system where they're being told what to do by people that are kind of like people that have the same background as me, right? Non-clinical people. And so then they end up feeling like they're getting treated like an assembly line worker. And
Hmm.
so when we focus on clinical interventions to improve health outcomes, one of the biggest things that we focus on initially and have a whole tool set for is provider engagement and
Right.
really working hand in hand with our provider partners to basically say, This is the problem. What have you seen? Okay. This is the evidence. What do you think? And then going to what you're saying, like we call it a GPS, right? So we work with them to drive the data to say, okay, well, we want to solve unnecessary utilization or improve readmissions. This is the evidence-based intervention that we could do for this patient population or what they want to work on. And as we're running these rapid sprint cycles, we are taking data that is really driven by things that they care about in the field to say, okay, are we moving in the right direction? Or are we not moving in the right direction? We don't believe that trying any intervention the first time is going to give you the gold star. So that's why we believe in this whole GPS concept of like what you're saying, Eddie, which is like, I live in Indianapolis. I want to go to Chicago, but right now I'm implementing my intervention and something's happening. I'm heading towards Nashville. I need to pause. I need to work with my team, and I need to figure out what parts do I modify. And
Yeah.
that's the rapid iterative cycles.
Yeah, and I love that. I think iterations are super important, and it's like it's fundamental to be doing those checks, and they're integrity checks, right? You're like, hey, are we headed towards Chicago? And you're like, no, we're headed towards Nashville. It's like, why are we going to Nashville? We're supposed to be
Yeah.
going to Chicago, right? So like, what do you got to do to fix it? And again, it's about being objective. It's about, hey, where are we trying to get to, and are we on course to get there, or do we need to make some adjustments? And it's even about, once you're headed in the right direction, are we continuing to head in the right direction? And I think that's huge. I'd love to take, we are, got a couple minutes left here, so I could probably talk about this all day, but I'd love to shift a little bit to just talking about the future, not, for Blue Agilus, but what are the things that you're excited about, not just on your roadmap, but future tech, the future of healthcare. Like, what are the things that you see on the horizon that that you're stoked about, and that you're really excited to see, that are coming up?
Yeah. So, as I mentioned, there's a lot of workforce burnout, and then there's a lot of pressure in really like our payment system shifting
Hmm.
from fee for service to value based care, where you pay for value, not pay for volume, which is a good thing because we know aligned incentives really make a difference in achieving better outcomes. And so, when I think about the future and I think about even like the staffing shortages and things that are happening in the industry overall, they need solutions that are localized to their environment fast.
Right.
And so what we're able to do with our platform is understand if you are a practice that has these attributes and you need to solve this problem, 75% of practices like yours has used this intervention and has localized it in this way and has been successful. And so
Hmm.
we're really kind of moving to like this ability to take the data that we have, which where we can deeply understand the practices and the providers and the workflows and the patients, and basically localize. We create a practice care plan where they can actually, we give them influenceable actions that they can do today to start kind of moving towards the outcomes that they want to generate for their
Hmm.
patients. And that's what I'm excited about, is a scalable way to do that, that's not only reliant on just humans to do it.
That's incredible. So, like, talking about maybe like some automations, and do you guys have any like thoughts on potentially implementing AI and machine learning in these types of processes in the future?
Absolutely, absolutely.
Cool. Yeah, no, I'm a big fan of machine learning. And again, I'll say it for probably the thousandth time today, but like, I love data, and I think it's huge because it not only allows you to, data really tells you, or allows you to tell the story, right? And I think that by using that, you can actually, and this is actually something where you can actually learn from the past as well, right? And you can actually take a look at, hey, we did this in the past, and running it through, and we got the expected results here, and we didn't get it here, and these are the the deviations between the two. And anyways, I could probably talk about that all day as well. But we're coming up on time here, Nadia. I'd like to say thank you for being on the show. It's been a great conversation. I love what you guys are doing at Blue Agilus right now. I'm excited to see see the company continue to grow, and see you guys continue to disrupt the healthcare space. So thanks for being on the show. Appreciate it.
Thanks for having me, Eddie.
Yeah. Carlos, do you want to come in and do the announcements really quick?
Yes,
There you
Eddie.
go.
Thank you so much, Eddie. Yes, actually, we only have Thursday and Friday, as you know. So we have tomorrow. We'll be speaking with Chris LaFarley from Tatum, and finally on Friday we'll be chatting with Anand Diraviyan from Airs. So, folks, uh, join us here on Tech Backstage Thursday and Friday. Well, actually, every day of the week. That's our end goal. But tomorrow, 11 o'clock in the morning Pacific time, and the same for Friday, 11 o'clock Pacific time. Join us right here on Tech Backstage, and have a great rest of the day, and be safe. Thank you.
Thanks, Carlos. Thanks, Nadia. Hope you all have a great day. Bye.